So are you ready to get those kids back to school? A lot of them are already in class for the very first time this morning, but some are still headed that way. A lot of things left to do. We have Dr. Leanne Detart-Newbert, who is with Providence Medical Group and Basor Physicians, and she is here to talk about getting your kids ready to go. And I know kids are already back in class, but still there's some things that some people haven't done. They still have time to do. What do we need to do?
Well, to be prepared to eat right is a very important thing because the body is just like another machine. You have to have the right fuel, the right amount of sleep, and preparation.
All right, so as kids are in the school for the first day, should they come home, take a nap? What time should they go to bed? You know, what should we feed them at night versus in the morning? Are there things we need to know?
Well, hopefully some of those patterns have already been started over the summer to break some of the sleeping in late and going to bed late patterns. But if they haven't, then a regular pattern of sleeping and eating should be established, yes.
Okay, what should we do? What should we eat? What should we be feeding them? I'm sure more fruits and vegetables.
Absolutely. I think probably the most important thing is planning, because what happens in our overscheduled school system and our overscheduled society in general is that things aren't pre-planned and we run out and eat fast food.
It's the fastest first thing we do, you know, if you haven't planned.
It is, and a little preparation, shopping at the beginning of the week, the things that we know we should do but don't often take time to do.
That's a good idea, shopping for the whole week at the beginning. That way you know what Monday, Tuesday, Wednesday, Thursday, Friday is going to be. What about immunizations? Do we need to talk about physicals as well?
Well, by the time school has started, most of the physicals should have been done already because the sports have started.
Sure.
The school physicals have been done, but if they haven't, that's important. And there are, of course, age-specific immunizations that will have to be done actually before the children enter school.
What about college students? Is there, you know, often we think about the little ones, elementary, secondary, but college education, those students, they're headed to college.
Well, yes, that's a very important transition time for many reasons. There are immunizations that they should have had, the meningitis immunization, for example. And it's for a lot of kids, it's the first time that they have what we call free feed. They have all the dorm food available to them, and it's very easy to not keep track of schedules, be under stress just because they're not sleeping well because of the newfound freedom, and then really make some really poor choices in the cafeterias.
Sure, they have that grazing opportunity there in the cafeteria, so we need to talk with them as they're back in school and college and just kind of remind them and encourage them.
Yes, that's right. There's a complex interplay between hormones and stress and not sleeping enough that contribute to that freshman 15 that we've all heard about.
We don't want that. Thank you so much for coming and sharing with us this morning.
You're very welcome, and thank you for having me.